Thank you very much, David. Let me just share my screen briefly. Okay. Okay, so hello from my side as well. My name is Lucia Pannese. I'm the CEO of a company based in Milano, in Italy, called Imaginary. So actually, our work around this topic is characterized by 20 years experience in EU-funded research. We have a multidisciplinary team, and what we have been doing is actually combining enabling technologies with game psychology and mechanics so that we are able to influence motivation, understanding, and behavioral change. Most of our work has been targeted towards telerehabilitation. So what we have now as our core business is a system called Rehabilitation, and that's a game-based telerehabilitation system, which is very peculiar and specific because it was not only produced, of course, together with rehab teams in different European countries, but it was co-designed together with patients between 60 and 95. So the logics was to pick those part of that part of the population of patients, which is the most difficult to address with digital technology. So actually, this is a little bit how it looks like. A patient is moving with free body movements in front of games. These games are actually functional tasks, mixing motor and cognitive stimulation and exercise. And particularly this older part of the patient's population is very well inclined to use it even autonomously from home because they see the point in doing exercise. They understand what they're supposed to do. They understand their progress through very simple things like scores and little feedbacks that are graphical, sound, and things like that. And actually, what the benefit is not only that they can train from home, but also that by doing so, by interacting with these games, they forget pain and fatigue. So actually their quality of life is really, really improving. Actually, the barriers are quite strong. We're a small company, so bringing innovation into something as difficult and as really sensitive like the rehab market is not easy. There is a lot of lack of knowledge in the market because specialists very often react to our system saying they're very surprised positively. They didn't even know that this is possible. So actually, there's really the need of a lot of information and bringing this technology to the right people and to the stakeholders of this community. Of course, there are restrictions such as the lack of reimbursement policies, which all over the countries with every country with its own peculiarities is still lagging behind. So policy-wise and organization-wise, there are restrictions also because new processes need to be put in place. The need for a medical device certification, which we have already in neurology, is a restriction anyway, because, for example, afterwards you're obliged not to change your system, while sometimes clinics and other stakeholders would like to see the system growing and having new exercises and so on. But then again, you're constrained by law, by the way, by bureaucracy. There is a lack of finance, because innovation costs a lot and it's very difficult to get fundings and to get investors, as we have heard from Ben as well, just right before me. And we suffer from lack of visibility, because small companies are hiding there in the big market. How do we change lifestyle behaviors? We were asked by David. I think that motivation, for example, through gamification, is the key, because people have to be motivated to change their behavior. They also have to understand why they should. So information and education also play a very important role. And I think from the very beginning, because if then it's a habit to behave in a positive way, to have a healthy lifestyle and so on, then it's much more easy to go on and keep it up. I also think that we can also reason on a different layer, like a change in urban spaces, for example, offering free sports areas, increasing green areas, particularly in urban contexts. So we have really to enlarge the system that we're looking at. That's my opinion. And the future, of course, I see development in technology, because that's part of my experience and my work, my job, but also a massive health service reorganization. And really, I believe that multidisciplinarity is really at the core of everything that we will have to face. I imagine there will be boundaries shifting, actors changing, new services being put in place. Healthcare cannot stay only in the hands of specialists, because they are just too few and the needs are too big. So we really have to think out of the box and change the space that we're looking at. And education will be one of the triggers that we have to play in these new scenarios that we have to put in place. That's the main thing that I wanted to say for the beginning. Thank you. Back to you.